now with Dr. Croll talking about caregiving for someone with Alzheimer's disease and the need to have a care plan in place.
Hi, DeMarco. So let's talk about what the burden of caregiving really looks like for a second here, because caregivers give up so much, right? Depending on how sick the patient is, a caregiver may need to be there with them around the clock. They may need to accompany them to doctor's appointments, prepare their food, take care of their finances, deal with the daily mood swings and fluctuations in behavior and confusion. All of this really adds up to quite a huge load, and there's not all that much support out there for caregivers. So I want to kind of talk about some tips that I want people to start incorporating into their care plans when they think about how to make this a little easier. Okay, so in my office, a lot of patients and their families come to me and talk about the behavior that they deal with as being the biggest struggle at home in many ways, where patients with dementia can often have sort of fluctuations in their levels of confusion and agitation and mood swings that can be really difficult to control. And for caregivers, that's an immensely huge burden. It's stressful. Often they tell me they feel helpless when they're dealing with that. So I want to just quickly go over some tips for navigating some of those tough moments. The number one tip I have is for the caregiver to try their best to stay calm. Okay, it's an emotionally charged situation. You want to try and take the charge down a notch. Don't argue, don't show that you're frustrated. Remind yourself that the patient can't control and regulate their own behaviors and feelings. So try and help them do that by being a good example.
So hard though for so many people.